Metformin has shown promising results when used alongside insulin for people with type 1 diabetes. Studies indicate it can help reduce insulin needs, improve blood sugar control, and even help with weight management in some cases. But the benefits vary between different groups of people, and there are some side effects to consider. Metformin is a medicine doctors usually given to people with type 2 diabetes. It helps lower blood sugar in two main ways. First, it reduces how much sugar your liver releases. Second, it helps your body cells take in more sugar from your blood. Unlike insulin, metformin usually doesn't cause weight gain and might even help some people lose weight. This makes it a good choice for people who are overweight. Adults can use metformin alone or together with other diabetes medicines, including insulin. The medicine works by making your body respond better to its own insulin. For people with type 1 diabetes, who must take insulin, adding metformin might help their insulin work better. Research shows that when people with type 1 diabetes add metformin to their insulin treatment, several good things can happen. A study found that after 1 year of treatment, metformin helped decrease blood sugar levels more than using insulin alone. It also reduced something called metabolic syndrome and lowered how much insulin people needed each day. These improvements happened even though there wasn't much change in blood fat levels. While people on insulin alone gained weight on average, those taking metformin with insulin maintained their lower weight. Another look at 5 studies with 301 young people found that using metformin plus insulin led to better HbA1c levels. HbA1c is a blood test that shows average blood sugar over the past 3 months. The people taking metformin also needed less insulin each day and saw improvements in their body mass index, or BMI, which is a measure of body weight. But not everyone benefits in the same way. In overweight or obese teenagers, HbA1c levels didn't change much with metformin. However, their BMI and body weight did go down significantly. For other patients, HbA1c improved by about 0.53%, but their weight and BMI didn't change as much. That is, as an example, if you had HbA1c of 7.4, it would have dropped to 6.87. That is quite a bit of change in the better direction. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. A larger review of 10 studies with 539 teenagers with type 1 diabetes found more evidence of metformin's benefits. After 12 months, HbA1c levels went down by an average of 0.50%. BMI decreased by about 1.05 points after 3 months. The amount of insulin needed each day went down at 3, 6, and 12 months of treatment. For people who have had type 1 diabetes for a long time, another problem can develop. Their bodies can become resistant to insulin, especially if their blood sugar levels stay high for a long time. Doctors sometimes call this double diabetes. Some healthcare providers give metformin to these patients to help their insulin work better. However, not all studies agree on how much metformin helps with blood sugar control in type 1 diabetes. Some research suggests it doesn't significantly improve HbA1c levels in the long run. One study saw improvements after 3 months, but these didn't last. But even if blood sugar control doesn't improve dramatically, metformin might still help in other ways. Some studies show it can lower cholesterol levels, help with weight management, make insulin work better, and reduce heart disease risk. Medical researchers have conducted over 200 clinical studies looking at metformin use in children and adults with type 1 diabetes. Most of these studies focus on how metformin affects blood sugar control and risk factors for blood vessel problems. Only a few studies have looked at actual blood vessel function or long-term complications. The effects of metformin in these studies vary quite a bit. At best, the positive effects on blood sugar, cholesterol levels, weight, and insulin doses are small to moderate. But even small improvements might help prevent complications over many years, since problems like heart disease and eye damage take a long time to develop. One example comes from a study that looked at patients with an average age of 29 years who had type 1 diabetes for about 12 years. After adding metformin to their insulin treatment, with an average metformin dose of about 2,124 mg per day, they saw several improvements compared to patients using insulin alone. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. Glucose concentrations went down more in the metformin group. The percentage of patients with metabolic syndrome decreased by 8.9% in the metformin group but increased by 2.5% in the insulin-only group. The metformin group also needed less insulin each day to control their blood sugar. While metformin offers several benefits, it's not without drawbacks. Studies show a higher chance of side effects when adding metformin to insulin therapy. The risk of low blood sugar episodes, called hypoglycemia, goes up. One analysis found the risk was 3.13 times higher with metformin. Digestive system problems are common too. The chance of having issues like nausea, stomach pain, or diarrhea increases by about 64% when taking metformin. These side effects sometimes limit how useful metformin can be, despite its benefits. The good news is that more serious problems seem rare. Studies haven't reported concerns about lactic acidosis, a rare but serious condition, or vitamin B12 deficiency, which can happen with long-term metformin use. For someone living with type 1 diabetes, the practical benefits of adding metformin might include needing fewer insulin injections each day. This can make diabetes management simpler and might reduce the cost of treatment. Weight management is another important benefit for many people. Intensive insulin therapy often leads to weight gain, which can increase the risk of heart problems. By helping prevent this weight gain or even promoting some weight loss, metformin might reduce these risks. For parents of teenagers with type 1 diabetes, the potential for improved blood sugar control without weight gain could be particularly valuable. Only about 14% of children with type 1 diabetes achieve the recommended blood sugar targets. Adding metformin might help more young people reach these goals. Doctors don't routinely prescribe metformin for everyone with type 1 diabetes. They usually consider it for specific situations. For example, if someone shows signs of insulin resistance, like needing very high insulin doses, or if they've gained a lot of weight on insulin therapy alone, or perhaps if their blood sugar levels stay high despite taking the right amount of insulin. The typical dose of metformin in studies was around 2,000 milligrams per day. But your doctor would determine the right dose for you based on your specific situation. They would start with a low dose and gradually increase it to minimize side effects like stomach upset. If you have type 1 diabetes and think metformin might help you, talk with your healthcare provider. They can assess if you might benefit based on factors like your current blood sugar control, weight, insulin needs, and other health conditions. Researchers continue to study metformin's role in type 1 diabetes care. We need more information about its long-term effects and who benefits most. Larger studies that follow patients for many years would help us understand if the small improvements in risk factors actually translate to fewer complications over time. Scientists also want to know more about the optimal dose and how long people should take metformin. The current studies suggest benefits at different time points, like 3, 6, or 12 months. But we don't know as much about longer periods. Future research might also focus on combining metformin with other medications that work differently. This approach might provide more benefits while reducing side effects. If you're considering metformin as part of your type 1 diabetes treatment, weigh both the possible benefits and drawbacks. The benefits might include better blood sugar control, lower insulin needs, and help with weight management. But you might experience side effects like stomach problems or more frequent low blood sugar episodes. Your personal health situation matters too. People who are overweight or show signs of insulin resistance might benefit more from adding metformin. Your age, how long you've had diabetes, and other health conditions also play a role in how helpful metformin might be for you. Remember that metformin would supplement, not replace, your insulin therapy. Insulin remains the essential treatment for type 1 diabetes. Metformin just helps it work better in some cases. Good communication with your healthcare team is crucial. Regular checkups will help track how well the treatment works for you and catch any problems early. Your doctor might adjust your insulin doses when adding metformin to prevent low blood sugar. Many people with type 1 diabetes strive for better blood sugar control without the burden of weight gain or extremely high insulin doses. For some, Metformin offers a helping hand toward these goals. But everyone responds differently to medications, so what works well for one person might not work the same for another. The decision to use metformin should come after careful consideration of your specific needs and goals, guided by conversations with healthcare providers who understand both the research evidence and your personal health situation. With the right approach, metformin might be one more tool to help you live well with type 1 diabetes. Disclaimer: consult your healthcare professional before changing your medication or lifestyle. None of the information provided by this video is a replacement for your physician's advice. Do not forget to click the like button and subscribe. On the screen, you see a video important to you. Thanks very much for watching this video. See you in the next video.